Hello and welcome to the award-winning Waterman Wellness. Your pathway to health and wellness with local experts is your guides. I'm Alyssa Haritzik. We have plenty of health and wellness news you can use in this episode, including you'll learn how specialized therapy is helping breast cancer patients cope with post-mastectomy pain. A local cardiologist explains how a type of radiotherapy can help correct a heart condition that causes atrial flutters. And when this Leesburg woman experienced alarming symptoms while on vacation, she rushed home to visit a Lake County emergency department to get the help she needed. First, a local hospital is offering advanced orthopedic treatment. Florida Hospital Waterman is the first and only hospital in Lake County to offer patients Mako robotic arm-assisted total knee replacement. Since 2012, the Tavares Hospital has been the only hospital in the county to offer the Mako partial knee replacement and total hip procedures. Orthopedic surgeon John Radnothy explains why this advanced technology leads to better patient outcomes.
The Makoplasty robot, and it's not really a robot, it's a robotic arm, just to be clear. That has been a tremendous blessing for this community. I've been doing partial knee replacements my whole career, over 25 years now. So I had a lot of experience doing traditional partial knee replacements. And those patients tend to do really good. I think with the Makoplasty robot, it's just a little bit more consistent, we're a little bit more precise, a little bit less sacrifice of normal bone and normal tissue, and just getting right to the pathology and being able to address that and not really damage any of the other tissue, and do it in a way that ensures us to have good leg lengths, good, proper, consistent orientation of the implants. But it's been interesting to see even how much better and how much faster they recover with the Makoplasty robot when we use that, just because it's more precise.
The total knee replacement technology helps adults suffering from knee joint pain, typically caused by arthritis.
We've learned the best way to do it compared to just a better way to do it. And I think that is reflected in the results of people. When people come in for their 2-week office visit and they're walking in and they're not even using a cane, let alone a walker, and their range of motion is better than mine is right now after 2 weeks, and they're not having any pain or very little pain.
In addition to offering the most advanced orthopedic technology in Lake County, Florida Hospital Waterman is the only hospital in the area to achieve the Joint Commission's Gold Seal of Approval for knee and hip replacement. You'll find more in-depth information about local orthopedic options by visiting fhwatermanortho.com. Imagine experiencing alarming medical symptoms while you're traveling. A Leesburg woman on vacation with her husband in St. Augustine explains why she insisted on immediately going home to receive treatment at a Lake County hospital when she fell seriously ill.
I woke up to go to the bathroom, and then that's when I started having the seizure. My whole left side went numb and it started shaking. And I said, I want to go back. I want to go to Waterman. If I'm going to be in the hospital, that's the hospital I want to be in. I didn't want to be in a strange hospital far away from home.
The couple immediately drove home, and Marshall's husband wheeled her into the Florida Hospital Waterman emergency department. Upon arrival, Marshall was comforted by the quick and attentive team who expedited her care.
They're going to see a provider at the same time that they're going to see a triage nurse, and that allows them to get things started very quickly, to get treatment started very quickly. They'll be able to, again, move rapidly through or to the point where they need to be and rapidly diagnose specific items.
I would say probably within 5 minutes or so, a physician's assistant came and he did a real quick examination and assessment of me and asked me a few questions. And in the meantime, a nurse was on the other side and she was starting an IV and drawing blood. And then the physician's assistant left and the doctor was right back in within 1 or 2 minutes. He did a quick assessment and I heard him calling out orders. I was kind of confused at this point because my brain was struggling with the seizures and everything. And he was walking out and he said, get her into CAT scan. And he stopped at the door and he turned around and he said, get her in priority right now.
Within minutes, Marshall underwent the screening needed to make her diagnosis.
And he said, you have a tumor in your brain. That was hard.
So because of the advanced technology that Waterman has and the 24/7 availability of CT scans, MRIs, X-rays, etc., we can diagnose many things. In addition to that, most of our emergency physicians are ultrasound trained in bedside ultrasonography, which really allows the development or the diagnosis very quickly for some life-threatening diagnoses.
Marshall was referred to a neurosurgeon who removed the tumor within about 12 hours of arriving at Florida Hospital Waterman. The tumor was benign, and 3 months later, Marshall is almost completely recovered. Marshall, a retired nurse, says she would not have done anything differently.
And you want to be in your hometown for my family, you know, when they came to visit me. That would be the first thing. The second thing is that my husband has had medical issues in the past also, and we've been through the emergency room before, and I can't say enough good about the staff and how they expedited my treatment, but as well as my husband. They treat you with so much dignity, and they treat you like a real person here. And that's why we came back here.
Visit the website on your screen to learn about the expansion of services underway at the Florida Hospital Waterman Emergency Department. In our next story, a Lake County man is crediting a local heart specialist with correcting a condition that could have caused a dangerous blood clot. Eustis resident Bob Tinsfield learned he had an atrial flutter during a regular checkup.
I had no idea, I had no symptoms at all.
Atrial flutter is mostly associated with some kind of structural changes in the heart. That is not a congenital disease. This is an arrhythmia in which the way I like to explain it is like the upper chambers of the heart develop like a microcircuit. What it does is start perpetuating in a circuit that is going and going and going at around 300 beats per minute. And every 2 to 3 beats, 1 beat will go to the lower chamber.
Mr. Tinsfield was referred to Florida Hospital Waterman electrophysiologist Miguel Bryce.
And he said, with a heart, you have either electrical problems or plumbing problems. The plumbing problems is your veins and arteries and valves. And electrical is that little electric sense that you get in your heart. It has your heart, the muscles in your heart collapse and squeeze the blood from one chamber to another. And he said, part of your blood is just keep circulating in that part of your heart and don't never leave. And he said, it could, cause a blood clot.
Dr. Bryce recommended a minimally invasive procedure called a cardiac ablation to correct the problem.
Cardiac ablation is a procedure that is done through catheters that get advanced peripherally through the veins and sometimes through the arteries up to the heart. After we identify the arrhythmia and identify what do we want to correct, then we can advance the proper ablation catheter, because all the other catheters I have on board are like the diagnostic part of it to find out, and those catheters will deliver energy. It's radio frequency energy that with contact with the tissue will modify the tissue. If you want to call it in lay terms, it's like a burning, but it's a very precise thing. So it's no laser, but it's damage of the tissue on purpose that we want, so then the current cannot go through and subsequently the arrhythmia get corrected.
You don't fool around with your heart. You got 2 eyes and 2 ears, but you only got 1 heart, and you got to take care of it.
You'll find more information about minimally invasive heart procedures available locally by visiting fhwatermanheart.com. It's time to take a short break, but we'll have plenty more when Waterman Wellness continues. You'll learn about specialized therapy that helps breast cancer patients deal with discomfort after a mastectomy. If seasonal pollen is making you sneeze, stay tuned for tips from our Eustis expert about dealing with allergies. And a dessert that even your doctor would recommend? We visit the Con Recreation Health Center kitchen with details. Want more health and wellness information? Sign up to receive Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery, and you'll also find a listing of the specialists featured in this month's episode. You might want to check out these upcoming community events. Don't go away. Waterman Wellness will be right back.
It's time for the Creation Health Tip of the Month. Your community may offer ways to adopt a healthier lifestyle. Today, look for nearby walks, runs, health screenings, and other healthy events.
Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Alyssa Haritzik. Breast cancer patients who have had a mastectomy may experience long-term discomfort from the surgery. A type of specialized physical therapy that is available locally can help patients feel better about moving again. Ann Murphy of Altoona told her radiation oncologist about soreness she experienced.
I have scar tissue and problems with this skin tightening and everything under my arm. If I raised my arm or just did too much with that arm, I could feel that it was stretching and it would hurt.
The specialist referred her to have lymphedema therapy at Florida Hospital Waterman Rehabilitation Institute.
Lymphedema is a swelling in an extremity. It comes about from inflammation or irritation to the lymphatic system. Some of these patients are people who had lymphatic cancer or they had breast cancer and they had mastectomies that involved working with the lymph nodes, and then it causes the extremity to swell. So these patients will come in and the lymphedema therapist will work with them manually to get the swelling out.
Well, there's exercises in there, massage therapy, and she has me wear, normally I'm wearing it's almost like a corset wrapped around me. It kind of helps, hold everything in place. It makes a difference when you go to somebody who knows what they're doing and can help you, do the exercises and stuff to help loosen it up.
No matter the condition that's being treated at the Rehab Institute, eStock says each patient receives a customized therapy plan to meet her needs.
Every patient is different, and that's one reason why we treat patients one-on-one here at Florida Hospital Waterman. Someone may need more strength-related therapy, while someone may need more manual therapy to decrease the swelling and increase their tissue mobility in the limb. Everyone's problems are individual, everyone's goals are individual.
Visit the website on your screen to learn more about the variety of rehabilitation services available locally. We turn to seasonal allergies in our next story. We sought advice from a local expert who says allergies may be the price we pay for our climate.
We do have patients that live somewhere else up north for 6 months and they come down to Florida. Yes, some of them experience things that they've never experienced before. And remember, allergies in general, things that can cause allergies thrive on wet environment, humidity, and we're in Florida, so you're gonna have a lot of that. Usually seasonal allergies start when you're a kid or in young adults, but it will carry over later in life. When people tend to have problems year-round, it's usually not seasonal allergies for the most part. Year-round symptoms usually happen when you have chronic exposure to the allergen, to whatever you're allergic to. And half the times it's things that are in your home or in your work when you spend most of your time. And this includes animals, cats, dogs are high on the list, mold, insects, roaches, dust mites, all of these things you need to check for in your home. There are a wide range of things that we can use. High on the list are nasal salines, water, salt, rinses that you can use. Antihistamines, they help with the itchiness and the stuffiness, but you gotta be careful and you don't never ever wanna treat yourself. Antihistamines some of them are sedating, so you may be sleeping. You can use decongestants, but also those have some risk. People that have high blood pressure, they need to be careful with those too. They want to check with the doctor to see which ones are appropriate for them.
As bad as it may seem for Lake County allergy sufferers, Dr. Rodriguez says it could be worse. The Orlando region is ranked 81 on a list of the 2016 allergy capitals, even better than Miami and Tampa. Jackson, Mississippi is ranked at the top of the list with the worst allergies. Visit fhwaterman.com to find a specialist to help you and your family with allergies. We know too much sugar leads to a long list of negative health effects. Next, we visit the Con Recreation Health Center kitchen, where Caroline Rowland and the Florida Hospital Waterman team have a sweet recipe even your doctor will want to share.
Springtime means more fresh produce is available at your grocery store or your farmer's market, but it can be hard to know what to buy sometimes. Now, to help us with that, we have Florida Hospital Waterman Executive Chef David Atkinson, and we have Creation Health Director Candace Huber, and you got a delicious recipe, and we're going to actually make a dessert today.
It's going to be wonderful. Not only is it beautiful to look at, this has a lot of healthy nutrients that we'll talk about.
This is basically like a healthy fruit crisp that we're going to make. It's got fresh mango, pineapple, strawberries. We're going to thicken that up on the stove, and then we're going to make a crumb topping with rice cereal, coconut, brown sugar, wheat germ, and macadamia nuts. We're going to make the crumb topping first because that takes a few minutes to bake. So all we're going to do with that is mix together our rice cereal, brown sugar, and the shredded coconut. This is wheat germ. So next we're going to take 1 egg white and a little bit of water, and we're just going to mix that together and add it to our topping, and that's kind of bind it all together. So we're just going to spread that out a little and then throw it in the oven.
So Candy, why don't you tell us a little bit about these fruits that are in this dessert?
Well, mangoes, pineapples, strawberries, all brightly colored fruits. We know when you see a bright colored fruit, it's going to be high in antioxidants, it's going to be a high anti-inflammatory product, all boosting our health. These are high in fiber also.
So our pineapples are cooled down now. They're still a little bit warm, but they're not hot by any means. We're just going to add that to our bowl along with our fresh mango and our strawberries. Yeah, we're just looking for a nice golden brown and a little bit crispy.
And you cooked that for about 10 minutes.
Yeah, it was in for about 10 minutes. And then to put it all together, we're just going to put a little bit of our fruit in a nice little glass, and then we just put a little sprinkle of our crumb topping on top, and there you have it.
If you'd like the mango coconut fruit crisp recipe, visit watermanwellness.com. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Alyssa Huritsik for the award-winning Waterman Wellness.